Now, across Nigeria and much of Africa, uterine fibroids affects millions of women, yet the condition is still widely misunderstood. Fibroids are non-cancerous growths that develop in and around the uterus. And while some women experience no symptoms, others deal with severe pain, heavy bleeding, infertility, and complications during pregnancy. Now, medical studies show that women of African descent are more likely to develop fibroids, often at a younger age and sometimes more severe symptoms. Now, despite this, many women delay seeking treatment because they assume painful periods or excessive bleeding is normal.
The result is that fibroids often remain a silent struggle, affecting not just physical health, but emotional well-being, family planning, and equally the quality of life. So to help us better understand the conditions and the importance of early awareness, we are joined by Adeola Olunloyo. She is a public health professional and also someone who's had the experience of actually living with fibroids. You're welcome. Good to have you here.
Thank you so much.
We had you on the last time, but it was for a different reason.
Yes.
This time we're talking about fibroids here.
Yes.
Very interesting bit that Inam revealed inside of the introduction to this segment here, that Africans are actually more susceptible to these. I'd like that answered. But first, let's start with the stats. What are we looking at when it comes to Nigeria and the cases of fibroids?
Okay, thank you so much for having me. It's important to note that Nigeria doesn't have a national data on fibroids. However, clinical studies show that about 45% of women are living with fibroids in Nigeria. 45%.
No, that's almost 50%.
That's like a conservative estimate because there are still many women who are not diagnosed because they don't have symptoms.
Wow.
Yeah, so if a woman doesn't come into the clinic to report symptoms that are adversely affecting her, she won't know that she has fibroids. So we're thinking it's more than 45%.
Let's also remember to mention that this segment is geared toward the fact that tomorrow is International Women's Day and all of March is Women's Month.
Yeah.
As men, we don't get that much, but it's okay. Now back to why Africans seem to be more prone to fibroids.
Okay, to be honest, there is no specific data or science telling us why. And part of the reason why there's a campaign ongoing now is to throw more light to say the burden of fibroid is huge, not just in Africa, but globally. However, there's little or no investment made in researching to understand why, for instance, it's 2 to 3 times more prevalent among Black women than white women. You know, there are certain suggestions around genetic predisposition, environmental or dietary factors, but it's not really nailing it because there's still not a lot of investment around research. Yeah.
Oh, this is a very deep one. Now, in terms of symptoms, and I think it's quite critical for us to note, because when you're looking at the uterus or the reproductive system of a woman, in Nigeria especially, you tend to find that there's so many different aspects. You've got the PCOS, you've got a number of them. So let's look at the symptoms that indicate fibroids. Can you?
Okay, I can use my lived experience as an example, but what's commonly shown is painful periods.
Okay.
And I like the fact that you said at the introduction that many women suffer this in silence because right from when we were young, for instance, when I started my period at 10, I started having dysmenorrhea, which is painful periods. And what I keep hearing is, it's normal, you're a woman. This is part of womanhood. You're supposed to feel pain when you're getting pregnant or when you're having your period. So many women silently go through fibroids without knowing that they have fibroids because we've been conditioned to suffer or manage the pain. And then there's excessive bleeding. For instance, when mine got really bad, I was bleeding for 12 days. And I was having very heavy periods. Now, as a public health professional, my work required me traveling a lot. So it used to make me very apprehensive. If I have to travel or I'm conducting a training or I'm working in communities, when I'm on my period, it's very distressing. For instance, if I don't have access to sanitary bathroom or there's no water to clean up, it's a lot. And I've had women even tell me sometimes they're in a conversation and they cough and a clump just, comes out. Or a woman sits down, goes somewhere, by the time she's getting up, she's soaked. So it's very embarrassing when you have women who can control, the excessive bleeding that they have. And of course, the other one which is very prominent is it distorts the uterine cavity. you see a lot of women who are looking pregnant, but they are not pregnant. So people are like, oh, congratulations, madam, you know, oh, and then people are waiting for her to deliver, but she's not delivering because she has fibroids. So those are just a few.
Now, I've had a few friends who have had the issue with fibroids, and oddly enough, some of them, you tend to find that this becomes something that's indicated when they're trying to get pregnant. Other than that, like you said, it's a we will manage it kind of situation. How then do we decipher between the various situations that might be, you know, plaguing a woman?
You cross out. Cross that out, cross that out.
How do we, what? Sorry, I didn't get that.
I would imagine you're saying, how do you cross out any other factors that you...
Well, early diagnosis helps. But you find that most Nigerians have poor health-seeking behavior. You don't go to the hospital until you're dying.
So I actually want to button on this early diagnosis that you mentioned. There, again, piggybacking from friends, you've had women have instances where they have indications or markers for fibroids, but then they're advised that, no, these are still small, let's wait for them to grow. Is that?
So that's like a cultural conditioning, like I said, where you think something that is, where you normalize what is abnormal. For instance, if you are bleeding more than 5 days, it's abnormal. You should seek help. If you are in critical pain where you can't function or be productive during your period, it's abnormal and should not be normalized. And it also shouldn't be when you are trying to conceive that you find out. You should have, you know, a lifestyle where you are being checked for your, you know, gynecology or reproductive health regularly, the same way you do your annual checks for, you know, your blood tests and stuff like that. So if it's not caught early, you don't even know you have it until it's advanced. And then there's also the issue of fear. Even when women feel that there's something wrong, they don't want to be labeled with fibroids because they feel like it's a death sentence. And that emanates from the fact that, you know, many women know at least one person who has passed from having a fibroid surgery in Nigeria. From the surgery. So even when they suspect or think that they have it, they would rather manage it than go to the hospital where they will tell them they have to go through the surgery. So there's that morbid fear.
How could it be that there could be a case where a person dies from the surgery?
Go to that question as well.
Well, you know, we have complications. I mean, I would say that we've gone far in advance and in technology that is being used to operate fibroids, you know, over the years. But in the past, we had cases where complications will arise and then, you know.
Let's talk about your instance, if you don't mind. You've been through this.
Yeah.
You've had one operation.
Yeah.
Tell us about it exactly, what happens at these operations and what the possibilities of a recurrence could be after an operation, because I hear that it could grow back.
Yeah.
Benign, yet it could come back.
Yes. So I lived with fibroids for 13 years. I was diagnosed, I didn't do my surgery until 13 years after being diagnosed.
Wow.
And I suspect that I had it even before being diagnosed because like I told you, I always had period pains, I always had heavy bleedings, and I thought it was normal until I was around like 30 that I said, oh, this is becoming too much when I started to have heavy.
30?
Yeah. That was when I took myself to the hospital to say, look, I'm having this problem, can you check what's going on?
So you're 30 at this point, so that means if you've had it for... Oh, that was when you went to the hospital, so you only got the surgery...
To report myself and say, I have a problem.
Okay.
And then we now started managing it. You remember the syndrome of managing?
For 13 years?
For 13 years. Because you know what? The strange thing that I was told then was, you know, because you're not yet married and you've not had children, don't think about the surgery yet. Just leave it and
This is what they told. They told a friend of mine the same thing.
And I find it preposterous,
So
especially
you have kids
from...
within that time?
I don't have kids as I'm speaking to you, but I didn't have kids then. But later on, I was like, how did I allow myself to suffer for 13 years? It has nothing to do with whether I can have babies or I don't have babies. Because until I got to the point where I said, you know what, I cannot live like this again. I want to have a quality of life regardless of whether I have kids or I don't have kids. I want to be alive today. I want to be happy today. I want to have
healthy.
you know what I mean? And that's when I decided firmly to say, look, I'm going ahead with the surgery. But here's the thing, because I hadn't had kids, okay, the truth of the matter is when I first thought about the surgery, I wanted a hysterectomy because I said, I don't even want to have periods anymore. I'm tired. I've been menstruating since I was 10 years old.
Oh, wow.
And by that time, I was 42. I'm like, you know what, enough. I was so angry, you know.
You should define what a hysterectomy is, actually.
Oh, that's taking out the womb.
Removal of the womb.
Yeah, or even the ovaries, everything around the reproductive system.
Now
so
back
I was
to anatomy.
angry enough to say that's what I wanted.
So back to anatomy, these are the organs responsible for the growths of these benign
the womb,
the uterus.
The uterus is the main organ that houses the fibroids, and that's where a baby grows.
Okay.
The fallopian tubes, ovaries are responsible for, releasing the egg that is fertilized and stuff like that, and the egg travels through the fallopian tube to get to the womb.
Were you?
I was.
But then, so let's talk about fibroids and childbirth. Does it mean when you have or have been diagnosed with fibroids, does it mean that, is there a risk of not having children?
Or complication even.
Or complications when it comes to children?
Factually, fibroids is not the most common reason for infertility, but a significant factor contributing to infertility.
Also.
For instance, you have PCOS, which is more prominent. You have male factor infertility, which is more prominent. You have endometriosis, but fibroids maybe accounts for like 15 to 20% of infertility cases, right? Yeah, but it also still adversely affects women when they are troubled and they can't conceive, because of course, when you have a big tumor growing inside of you and displacing the baby, or not even allowing the baby to be, the embryo to be implanted or to develop, so it causes miscarriages, it causes hemorrhage, it distorts, it just makes it difficult for a woman to get pregnant if she's having, fibroids and she's trying to conceive. However, there are women who have had children who also still have fibroids. And they have to make the decision to say, you know what, I'm done having children. So maybe just remove the womb because I'm not going to be using it. But for a woman who has not had children, then the medical personnel has to tailor whatever options they have to suit her own fertility status, because if she still wants to have children, then you now have to start looking at other options. But I didn't really still understand why I was being told to manage it and wait and not have the surgery, perhaps because they know it grows back. So I had my surgery in 2023, and then last year, when I still went for a scan, I was told that I have one fibroid growing again.
Oh dear.
2 centimeters. So it's true to say that it grows back.
How does that make you feel?
Regretful in a way that I didn't take out, that I didn't have the hysterectomy. But for now, because I had the
regretful.
I'm just tired.
Okay.
Do you get what I mean? I don't want to revisit going back to what I went through. But right now I'm okay. My menstrual cycle is stable, and I'm not in distress like I was when I had the first surgery in 2023. So I'm hoping, my doctor says menopause is around the corner, that I probably won't get to the stage where I have to do another procedure.
You mentioned not having kids.
Yeah.
You still do not have kids.
I don't have kids, and I'm not married.
You'd not desire to have kids?
Oh, I've tried, and that was that's a different conversation, a different story.
Right.
Because I've had attempts to use IVF to have babies, but it wasn't successful.
Now, was that could the fibroids have been a contributing factor to the failure of the IVF?
And well, scientifically, fibroids affect the success rate of IVF. But in my case, I actually did not want to carry the baby. Because at the time, I still had fibroids, and I actually had fibroids and adenomyosis, and I still have adenomyosis, and that's completely different from fibroids. Adenomyosis grows in the uterine, it covers the entire uterine lining, right? It doesn't grow out like a tumor, but it's embedded and also causes, pain and bleeding.
I'd like our viewers to know that you actually are willing to talk about this. We had this conversation from before, so it's not like as if we're badgering and
oh no!
Honestly, I think I've been an advocate. I wish we had an audience, or our producers could, check our YouTube and see if they've got questions.
Because there will be many questions.
Women, like I said, in a group of 10, 1, maybe even 3 in 10 women.
You remember what she said?
We're talking about 4, almost 4 or 5 out of 10 women are affected.
Mazino, I mean, it's crazy in such a way that you'll have a conversation with someone and they'll say, oh no, I was not around, where were you? I was in hospital. Oh, you're not feeling well? No, I have fibroids. Or my wife is not feeling well. Oh, is she okay? Oh,
it's rampant.
It's rampant and it's quiet. And guess what? A lot of women now are also having hysterectomies. Silently. Because, there's this taboo around, you are not a complete woman if you don't have a womb.
I mean, it's between me and you. You don't know if
I don't even care. I'm just saying, if we don't talk more about it, and if more women do not share their story, which is why I actually want to commend Lupita Nyong'o. She has started a campaign. You saw it, Make Fibroids Count. I also did it, and I said I was going to use that as a leverage to share my own story, because there's so much to unpack around women's reproductive health. But the silence and the the low or no investment in women's health, has to change. And that's what Lupita is trying to drive home.
It's a very good drive, very good endeavor. But one thing I'd like to ask, and I'm sure that there's a lot of people out there who have this question in mind, and they're hoping that somebody could bring it up. What is the worst that could happen when you choose not to take out the fibroids? Does it affect your standard of life, your mode of living?
Absolutely. It affects your quality of life. Like I told you, I got to the point where I hated myself. I hated my body. Because
what does it manifest as?
I mean, bloating, she had mentioned
anxiety.
You look
Look, we don't even look at the mental impacts. We're looking at, if we look at the physical, it's not normal for me to, for instance, be on stage here if I'm on my period and I'm scared that I'm going to soil myself. I didn't have access to the right sanitary pads. I always had to buy imported pads, and if I run out of supplies, I'm in trouble. There are women who are using adult diapers for their periods because the normal, regular pads cannot survive. And now imagine this means women who are poor and lack access to these sanitary pads, what they go through. They may not even have to, they may not be able to walk or go out when they are having their period. So the effects really, it doesn't make sense for you to live like that.
Still talking about the effect on a woman.
Yeah.
Now, if you have to, if it affects your menstrual cycle, that means you're losing blood. Does that make you anemic?
Of course. Yes. One of the effects is anemia, dizziness.
This manifests as what? Loss of weight?
Iron deficiency,
fatigue, unproductivity, and even it affects intimacy in marriage. If a woman is going through all of that, you think she wants her husband to touch her or she wants anybody to come near her, and this can put a strain in the marriage, And then we talked about infertility again. It can also affect it. It affects her going to work. If she can't walk because she's not productive, she's not in the right frame days. Exactly.
This would be a good call for the authorities to assist. So what policies do we have on ground that assist women who are living with fibroids or want to have operations to get them out?
I am not aware of any policy. And one of the things I would like to appeal to our current Minister of Health, Professor Mohammed Ali Pate, who happens to also be a renowned and respected global health leader, is to include, free access to fertility care in the national
and sanitary
health.
material.
Yeah, and I mean into national health insurance, because many women cannot afford fibroid surgery. I was very lucky. I was working in a good organization that gave me health insurance, so I didn't have to pay. But it's really expensive and unaffordable for women.
What would it cost to have such a surgery?
There's been inflation. You could be looking at between what?
3 million plus.
3 million plus. Or less if it's a government hospital. But if it's private, you can pay more depending on, because every woman's case is different, how complicated it is, where the fibroid is located,
how big, how many.
Big, and all of those things. So
I was privy to some information about Lagos State actually assisting women, especially at Lagos State University, if I'm not mistaken. But this was very many years ago. It was about 8 to 7 years ago. I don't know if it still stands now, but they were able to actually go get diagnosed and perhaps also get assisted if it comes to the operation itself. So that seems to be that if there's no awareness for that, or if it doesn't exist at all, then there seems to be a gap.
There is
as a public health professional, are NGOs jumping in? Are individuals jumping in? Who is championing the cause to help women with fibroids?
To be very honest, fibroids is a neglected area of reproductive health. Nobody is dealing with it. Nobody is supporting it. Nobody is funding it. And which is why I feel strongly, or I'm recommending strongly, that Nigeria has the opportunity to lead the way in Africa, because we are the largest, the most populous black nation, which means the burden of fibroid is huge in Nigeria. We have the opportunity to lead when it comes to fibroid research, mobilizing resources and funds and stakeholders under the leadership of the Minister of Health to get more funds to focus on fibroids research, because we even need to know the simple question you asked me: why is it higher among black women? We have rich data in Nigeria because our health system has decades of experience managing fibroids, performing fibroid surgeries, and our doctors are among the best when it comes to surgeries. I'll make you laugh. In 2016, before I had my surgery in 2023, I actually went to the US to get my surgery done, because I wanted a minimally invasive option, which is called the laparoscopic myomectomy, which means
Where
they
they
won't
stick it
open
in.
me.
Yeah,
They won't open me up. But guess what? The doctor that I went to see didn't know fibroids.
Oh.
No.
And I was botched.
Are you
I
serious?
came back with more complications than I left.
No.
And I had to get my fibroids surgery done in Nigeria. I'm telling you.
So
So
there's
going
a-
abroad is not guarantee for you to get better access, except you've done your research to be sure that the doctor you are going to see has managed black women with fibroids extensively. Otherwise, if you fall into the wrong hand, it's
I don't know, Inam, if you...
So,
if this is...
my point is, Nigeria has every opportunity to lead in this research, to take the lead, raise funds, study, because we have a large pool of women who have been managed or who are being managed and who are still going to be diagnosed,
So I'm
that we can
interested-
study the profile to see what the patterns are and understand how we can manage.
Joe was on the floor for a
curious
very
to
long
know,
time.
especially with that being said. Now, of
Yeah.
course, it's science. Is there, based on research that's available, and maybe some that you've done for yourself, do we actually know the cause of fibroid?
We don't. They're just suggestions. Like we say, genetic dispositions, hormonal imbalance, environmental or dietary. They're just suggestions. There's no factual research nailing it to say this is the real cause.
Okay, one more before I go, before they kill me in my ear. Let's look at fibroids and let's look at ovarian cysts. How do these differ?
Ovarian cyst is completely different. I'm not a medical doctor, so I won't be able to give too much details on ovarian cyst, but it's completely different.
Okay.
Yeah, the way, the ovaries are affected with ovarian cyst, but with fibroids, it's in the uterus.
Okay.
The ovarian cyst is not in the uterus.
Okay.
Yeah, and ovarian cyst can affect maybe the eggs being released and stuff like that.
Any
Oh,
more,
wow.
Inam?
I mean, I have a lot, but they're yelling in my ear, telling me that no more questions.
Hence my sarcasm. But thank you very much, Adeola, and thank you very much
for
for also
having
opening
me.
up and telling about your experience as well, because it's not something people do very easily.